Pediatric strokes are quite rare in people, often affecting 1 in every 4,000 newborns and an additional 2,000 older children each year. But unfortunately, they do occur. Sophie Kasaga is 8 years old. 4 years ago, she started getting complications as she was playing and she had to be rushed to hospital. Her mother, Namatov says her little girl was playing with fellow children, and when she got back to the house, she slept on her stomach like someone watching television. According to Namatovu, that was the moment she realized that something was wrong. She noticed that her daughter's voice was lowered, unclear, and she could not sit, so she rushed her to hospital. Currently, this girl is on physiotherapy to learn how to use her body parts. She's now learning how to talk, write, walk, among others. A stroke is a brain injury that happens due to an interruption of blood supply to the brain. Dr. Ambrose Simwe of Capital Center Medical Clinic in Bwaise says there are 3 types of stroke as he takes us through.
So anything that blocks the flow of blood to the brain cells can cause what we call ischemic stroke. And actually, ischemic stroke is the commonest type of stroke we have in the whole world.
Anyone can suffer stroke, including babies who are still in their mother's womb. And Dr. Simwe takes us through risk factors for strokes, which include obesity, smoking, and overdrinking, among others.
Or not pregnant or anyone. Most of these substances we have, especially in cigarettes, most of these substances interfere with blood flow in the blood vessels. And once we have any interference in the blood flow, it means if this happens to the blood vessels that take blood to the brain, we can have shortage of oxygen, which moves through blood to the brain, and we can have a stroke.
There isn't medication for stroke. However, there is available treatment which depends on severity of the brain injury, as he explains.
So we have emergency medical care. That's where we have oxygen, life support, stabilizing the patient. Once the patient is stabilized in the hospital, we start on rehabilitation.
Early treatment with medication like clot blaster can minimize brain damage. Other treatment focuses on limiting complications and preventing additional strokes. Shamim Natebwa, CTV PM Edition.